I'm Deidre Burton, and I'm a pediatrician at Metropolitan Pediatrics.
I'm Beth Torwekar. I'm a pediatrician or a pediatric hospitalist at Randall Children's Hospital.
Obviously, it's been a tumultuous year. What does that look like from your vantages?
Really, kids of every single age are affected by the stress of 2020. It's really just present for all of us.
A lot of the things that are going on right now, we can't change, which is part of why it's so stressful. What are some of the solutions, though, for families going through this stress?
To recognize that this is happening to everyone. We're kind of all in this together, and that we have to really adjust our expectations. We have to be satisfied with sometimes things being good enough. I frequently tell my parents and families that being grateful is like getting a vaccine against anxiety and sadness. What you can celebrate today, what you're looking forward to tomorrow is important. I'm also encouraging families to be creative about the way that they connect with friends and families. In my own family and others, that we connect via Zoom with people that we wouldn't have normally connected with. And so that's a win.
I think going through all of this, it's tough for everyone to come to terms with, let alone maybe a younger child. What are some of those conversations that adults can be having that will make this easier?
It's about just being honest. Kids are really observant, and sometimes it's much harder to have an unanswered question than for them to fill in the blank and come up with something really awful. And finding some things that they can do actively, like making an IOU, like, okay, Grandma, now you owe me 5 hugs, and making some coupons to be able to catch up when we are not socially distant. When we have something that we can control and do, that makes us feel better.
We are almost a year into this new kind of life. Hopefully it'll change soon, but it could still be a while. Are there things that people haven't been talking about that you think would be worth mentioning or having to be a part of the conversation?
I think really just taking every opportunity to empower each other and to feel like, yes, these are monstrous challenges thrown in front of us. And in that, we have these opportunities to connect in new ways and to feel like we're kind of banding together toward a common goal, that even a 4 or a 5-year-old can understand that they're doing something important when they wear their mask like they saw their doctor or their mom do.
And look at others and what others are experiencing. And is there anything that I could do to help? Being able to contribute gives us a sense of purpose and belonging, and it feels good. It elevates our own moods, and it really does help us be more resilient.
How important is it for adults to be taking care of their own mental health through this to then make sure that kids are doing well too?
The airplane analogy of put on your own oxygen mask first before you put on someone else's. And it's really true. And you want the best of you for your children. And they're not getting your best if you don't get sleep, if you don't exercise, and if you're not intentionally connecting to people who bring you joy in your life outside of your children.
I think the burden of stress and just the tremendous challenge of this year has left a lot of parents putting a lot of unnecessary blame and pressure on themselves. We're all trying, and we all will have days where we fall short.